Good afternoon, all colleagues. I welcome you all who have logged into the virtual mini plenary session. We will now have an opportunity for silent prayer and meditation. Thank you, honorable members. Honorable members, before we proceed, I would like to remind you that the virtual mini plenary is deemed to be in the precinct of Parliament and constitute a meeting of the National Assembly for debating purposes only. In addition to the rules of virtual sittings, the rules of the National Assembly, including the rules of the debate, apply. Members enjoy the same powers and privileges that apply in a sitting of the National Assembly. Members should equally note that anything said in the virtual platform is deemed to have been said to the House and may be ruled upon. All members who have logged in shall be considered to be present and are requested to mute their microphones and only unmute when recognized to speak. This is because the mics, honorable members, are very sensitive and will pick up noise which might disturb the attention of other members. Please, let's do that. Let's check now. When recognized to speak, please unmute your microphone and connect your video. But we will understand if you're having problems with your network. But if possible, let's open up. Members may make use of the icons on the bar at the bottom of their screens, which has an option that allows member to put up his or her hand to raise a point of order. The Secretariat will assist in alerting the chairperson to members requesting to speak. When using the virtual system, members are urged to refrain or desist from unnecessary point of order or interjections. Order of the mini plenary. Honorable members, we shall now proceed to the order, which is debate on vote 18, Health Appropriation Bill. Honorable members, I will now recognize the Honorable the Minister of Health.
Thank you very much. Thank you very much, Honorable Chairperson. Greetings to you, greetings to my colleague, the Deputy Minister Dr. Dlomo, the Chair of the Portfolio Committee on Health, Dr. Jacobs, all members of the Portfolio Committee, members of the National Assembly, colleagues, MECs who might be on the platform, leaders of various entities which work with us, those which report to the department and those who are also our stakeholders, ladies and gentlemen, and members of the South African public. We thank the Honorable Speaker through you, Chair, for this opportunity to present to you, to the House, the budget vote 18 of the Department of Health for the financial year 2022-2023. Honorable Chair, we present this budget vote at a time of lots of hope and optimism after a devastating 2 years of the COVID-19 pandemic. As a country, we have witnessed 4 waves of this COVID-19, and we are now in speculation as to whether we are already in the 5th wave, or is it still coming to our shores. Indications thus far are that we are not yet in the fifth wave, but that as the winter encroaches on us and we spend more time indoors, including in family and other form of gatherings indoors, the risk of the fifth wave will be getting much more stronger. It will continue to loom large upon us. Over the 4 waves, we have lost loved ones, family and friends, work colleagues, national leaders and icons from various aspects of life, including politics, religion, traditional leaders and business leaders, and across all aspects of society. And even this House of Parliament, both the National Assembly and the NCOP, have not been spared the wrath of the COVID-19 as we have lost some of our colleagues. We thank the leadership provided by our government under President Ramaphosa for not only guiding the nation throughout these turbulent times, but for mobilizing all of society behind the mitigation interventions. I wish to restate again that the measures that government took utilizing the Disaster Management Act were meant to protect the people of South Africa against the harshest impact of COVID-19. These measures helped us to flatten the curve and make sure that we are not overwhelmed by this pandemic and that our health services could cope. All of us will remember the images we saw of the devastation, the various parts of the world, in various continents, such as in Europe, images from countries such as Spain, Italy, the US. Who can forget the images on TV of New York and other parts of the US, Brazil, with hundreds of thousands of people dying from the virus. We are grateful that while our country has also suffered a lot, including the loss of more than 100,000 lives on record in terms of a formal record, but although we know also that in terms of excess deaths, the estimation is probably double. Also the devastation to the economy with massive job losses. Our health services, while it struggled, especially under the first 3 waves, it never collapsed under this pressure. Our health services remain standing under pressure, but still remain standing. We thank leaders of all sectors of society for working with government. We wish to assure all South Africans that as government, we get no joy in inconveniencing you from time to time with restrictions. We say sorry where we have wronged you, but please be assured that all interventions were meant and are still, even now, are still meant for all of us to avoid severe impact of COVID-19. We completely disagree with armchair critics who argue that we should just drop all public health measures and just let the virus spread at will, and that we should only worry about whether we've got enough beds in hospitals and whether we still have oxygen and ICUs. We disagree with this. As public health authorities, we believe that we should guide the nation in terms of prevention of severe impact of this pandemic. While the pandemic has derailed some of our programs as we had to direct many resources to dealing with it, we have also had positive experiences and lessons during this period. We have learned to work as all of government, from local, national, and provinces, and also to bring in skills and expertise from various entities. We have learned on how to work together with the private sector, from securing of commodities such as PPEs and diagnostics and therapeutics, and even more cooperation working together in securing and also administering vaccines. We have learned how to work with our scientists to guide our intervention. Not always easy, because scientists themselves don't agree on everything. But we've learned, we have really gained a lot from this cooperation and their intervention. And of course, as scientists, will, like any other people in society, will not always agree on everything, but it's been quite useful. From where we were last year, this time, we have made lots of progress with our vaccination program. As of yesterday, we administered 35,182,000 vaccine doses, to just over 19,700,000 individuals from the adult population, which translates to 49.5% of all adults at least having had a vaccination, still below 50%, still not very good. Whilst it is also true from some of the experts that more than 70% of the population have had contact with the virus and therefore do have some natural immunity. The truth is that this immunity wanes with time and cannot be boosted, unlike vaccination. So while the virus is amongst us, the best defense is still vaccination. We have been allocated another just over 2 billion rand for the 2022-23 financial year can add also to if we need more vaccine doses. I wish to take this opportunity to express our gratitude to our gallant health workers who have been and still remain the front warriors against the COVID-19 pandemic, just as they have done also against HIV, TB, and non-communicable diseases. They have risked their own health and their family's health, and many have paid with their own lives. We pay tribute to them and their families, and may the souls of those who have departed in the battle against COVID rest in eternal peace, including the health workers and all our citizens who departed as a result of this pandemic. Honorable Chair and members, in this financial year, our major focus will be on the recovery of our comprehensive health services. We have already agreed with all MECs that going forward, the key is to integrate mitigation against COVID into our comprehensive basket of services from primary healthcare levels upwards, including the vaccination program, which must increasingly be part of the comprehensive health services. We want to refocus on improving the quality of services as guided by various policy documents, especially the National Development Plan and the Presidential Summits of 2018, and also the Health Compact, which was signed by various parties, various stakeholders in 2019. We again call on everyone above the age of 12 who is not yet vaccinated to come forward and receive their vaccine to protect themselves and those around them. Our budget allocation for the financial year 2022-23 is a total of 64.5 billion rand, of which 86%, or just around 55 billion, will be transferred to provinces as conditional grants to support various activities such as HIV and AIDS, TB, STIs programs, support for human resources, including medical interns and community services, community service doctors and other professionals, and also significant allocation for infrastructure support. We are, however, concerned, honorable members, that in terms of the indicative amount over the next 2 years of the MTF, our budget will be declining by 1.7% nominally, even before considering inflation, which cannot be good for sustainability of our health services. Honorable Chair and honorable members, as a government led by the African National Congress, we remain committed to the attainment of universal health coverage for all South Africans. We urge all members of the portfolio of Parliament from the Portfolio Committee and also into the full House to support the NHI bill, which is currently in front of the Portfolio Committee, because this is our instrument to achieve universal health coverage. In the meantime, we are laying the foundation for a strong public health system, which will be underpinned by an integrated health system for the country. We want to bring down the barriers between private and public and just have one integrated health system through the National Health Insurance as the tool to implement that. The COVID-19 has facilitated closer cooperation with private health providers, from sharing hospital beds at the height of the COVID to a common platform for reporting on COVID-19 tests and also availability of beds, also recording on the vaccination through the EVDS, which is the common platform for all providers of vaccination, which is publicly owned under the Department of Health. Within this budget allocation, there's an allocation which is made under the NHI program. Essentially, this is meant to strengthen the public health platform such as targeted infrastructure upgrades across the country, contracting of private PHC providers, doctors and nurses, acquiring of oncology services, and also adding more capacity for mental health services. We also have a ring-fence amount to prepare for the implementation of the NHI program once the bill is passed. Such preparation includes the design of benefits, the pricing of benefits, provider accreditation, management of health products, procurement, further development of the digital platform and digital systems, and developing risk management and anti-corruption systems. A lot of progress has been made with the health patient registration system, which has now registered more than 57 million South Africans in more than 3,100 health facilities. Further work has to be done towards the establishment of the single portable patient record system with interoperable digital systems. Improvement of quality of service at public health facilities will be a major focus in this year. Already 21 quality learning centers have been established in the country, with 102 hospitals, including some private ones participating, also PHCs, primary health clinics, and also 25 emergency medical service centers participating in the quality learning centers. Good quality health infrastructure, including its maintenance, is very key to achieving good quality public health. The National Department, working with provincial departments and their infrastructure departments, will be delivering a lot of upgrades of infrastructure. In this financial year, an amount of 1.5 billion rand will be managed by the National Department to support various infrastructure projects in various provinces, especially in the NHI pilots, with contracts already allocated for infrastructure upgrades in places such as the Siloam Hospital in Limpopo, Zitulele and Bambisana district hospitals in the OR Tambo districts in the Eastern Cape. The contract also for the construction of the multi-billion Limpopo Academic Hospital is already in progress, and the contractor should be appointed, and we expect that construction of this very important academic hospital in Limpopo will start before the end of this year. And in the past financial year, 51 clinics and community health centers were constructed or revitalized. 21 hospitals were also revitalized. And also backlog maintenance were done at more than 50 projects throughout the country. Honorable members, in the current financial year, provinces will share 6.8 billion rand in conditional grants, which will be managed directly by the provinces under the Health Facility Revitalization Grant to construct, revitalize, maintain hospitals, clinics, and other facilities. Within this also, we will also be taking forward the rehabilitation of the Charlotte Maxeke Academic Hospital, which was damaged by fire last year. And also we're pleased also to announce that the water has finally been reconnected to the Prince Mshieni Hospital in Umlazi at eThekwini after the floods. Adequate staffing is very key to improvement of quality service. This presidential stimulus package, which was announced by President Ramaphosa in 2020 as an intervention for the COVID, was continued also in 2021, and this enabled provinces to employ more than 73,000 additional staff, many of them on short-term contracts. All provinces have experienced some challenges in the current financial year, as the allocated amounts for COVID have been reduced due to the reduced burden of the pandemic. Additionally, 2,429 medical interns, community service personnel, amongst them doctors, nurses, pharmacists, were also employed. We are grateful to the additional 2.1 billion rand over the next financial year, which has been allocated for us to be able to hire medical interns. This will make it easier for us to confirm the allocation of interns and medical community service doctors early enough so that they can be certainty. Progress has been made also in the employment of community health workers, even though more still needs to be done. Going forward, we have to make sure that we implement the 2030 human resource strategy for human resources for health strategy. We hope to finalize also more certainty in as far as the community health workers, more certainty in terms of their engagement, even though already all provinces have confirmed the appointment of at least 47,000 community health workers. Honorable members, this employment of the community health workers will help us in health promotion, prevention of disease, adherence to treatment for HIV and AIDS and TB, also for non-communicable diseases. A total of 5.4 billion rand is allocated in this financial year to support various aspects of health professions training in provinces, including additional personnel where necessary. We have made a lot of progress over the last 13 years, honorable members, in our fight against HIV and AIDS. The Tembisa model estimates that estimated that 8 million South Africans in 2021 were positive for HIV, with a prevalence of 13.4%. As of on June 2021, the number of people on antiretrovirals was sitting at 5.4 million, meaning that there's still a gap of almost 2 million people who are estimated to be HIV positive but not on treatment. Our major concern is continued spread amongst young people, especially young girls. Key strategy is to provide widespread testing, especially index testing for contacts, start on treatment and maintain on treatment so that people who are positive can be virally suppressed. We make these services available at points of care where testing is done, including also in mobile clinics. Our target is to find another 700,000 people who are estimated to be HIV positive during the course of this year, to bring to a total to more than 6 million of people to be treated, to be put on treatment. As I said already, we have about 5.4 million already on treatment. Our treatment coverage, for those who know their status, suffered a lot during the COVID lockdowns. We went down from about 85%, went down to 76% of those on treatment. So because of this pandemic lockdowns, we have not been able to reach our target of 90 in 2020, but we are recovering, and we hope that we should be able to reach the 2025 target of 95. But first we must reach 90. An amount of 24 billion rand has been allocated. I can see, Honorable Chair, that it looks like my time is becoming a casualty. Just to one or two more points, just to say that also in the area of reproductive health and reproductive health services, they also suffered from family planning during the lockdowns, but we are doing a lot to recover. The children immunization also did suffer, but a lot of catch-up is being done. And lastly, let me just say, Honorable Chair, that we are doing a lot also to do away with medical legal claims which are eating into our budgets. In some of our provinces, as high as 900 million in one financial year have gone to litigation. And we have put processes in place to make sure that this can be reduced. We're working with all the provinces. Lastly, let me just say, Honorable Chair, that I want honorable members to say that even though our services work under a lot of pressure, we also appreciate the fact that there's a lot of excellence in many of our facilities. And in this case, I want to recognize the Steve Biko Academic Hospital, which received the Diamond Stroke Award just last week during the 8th International European Stroke Congress, for a unit of stroke unit, which is one of the best in the country and best in the world. So we say to our health workers, you are appreciated. And on that note, thank you very much, Honorable Chair and honorable members. Thank you for the time.
Thank you very much, Phahla Hlabirwa Ra-leboga. Honorable members, when I switch on my video, you must know you are left with 1 minute full. So let it not intimidate you. It's just a warning to be, wrapping up. The next speaker is from the ANC and is the Honorable Jacobs, the chairperson of the Portfolio Committee. The Honorable Jacobs.
Thank you, Honorable Chairperson, and thank you, Minister, for that reply. The ANC rises in support of this report of the Budget Vote 18 on the Strategic Plan and Annual Performance Plan of the National Department of Health and its entities. Healthy citizens are the greatest asset any country can have, and that's a quotation from Winston S. Churchill more than 70 years ago. So the question is, how healthy are our citizens? The vision for the health sector is to ensure a healthy nation for all South Africans. Achieving a healthy population isn't easy for any country, rich or poor. We are therefore not excluded. The number of deaths from natural causes at the national level amongst persons 60 years of age and more is increasing slowly and is about 25% higher than predicted. There are gentle increases reaching above the upper prediction bounds of Gauteng and KwaZulu-Natal. The morbidity profile comprises coexisting infectious and non-communicable diseases, including the new infection by coronavirus, commonly known as COVID, HIV and AIDS, TB, other conditions such as diabetes, hypertension, vascular diseases, child diarrhea, malnutrition, and high levels of interpersonal violence and accidents. The risk factors for cardiovascular disease are high in both urban and in rural parts of our country. So does this then put an obligation on us to provide a healthcare system that benefits every single man, woman, and child in our country? And the answer is very simple. It is yes, we do. The department has proposed to transform health through the introduction of a national health insurance, which will address the inequalities in our national healthcare system to ensure that every South African has access to healthcare services regardless of their socioeconomic status. This is a critical policy imperative which the ANC is committed to realizing. The parliamentary process is at an advanced stage where the desirability of the bill is the next discussion point of the Portfolio Committee. We are looking forward to completing this process at the National Assembly. The coronavirus pandemic has tested the capacity and the capability of our healthcare system. The pandemic tested the commitment and dedication of our healthcare workers and their resilience. It also laid bare the weaknesses in our healthcare system, such as our health facilities, with capacity backlogs of infrastructure and health equipment. The President, in his State of the Nation address, outlined key priorities which this vote should respond to. A critical priority for health in the current conjuncture is overcoming COVID-19. Vaccines have proven to be the best available defense against illness and death from COVID-19. The vaccine rollout has so far seen 35 million doses of COVID-19 vaccines administered. The management of the pandemic displayed the capability of our government and its ability to crowd in private sector participation in realizing our national imperatives. This mirrors the integration the NHI seeks to create. For this purpose, this budget has allocated 2.1 billion rand to provinces for contracting primary healthcare providers and mental health and oncology service providers. The budget vote also responds to addressing communicable and non-communicable diseases. Tuberculosis, HIV and AIDS and cancer remain a major cause of death in our country. It is also important that we consistently monitor our health through testing. We welcome the support provided to the tracking and tracing of patients lost to follow up for TB and HIV, as traced by community health workers at 350,000 for the current year, and the department targets to start having 221,900 people on TB treatment. We also welcome the introduction of HIV self-screening to 200 facilities. There are clear interventions to mitigate any lost focus on these diseases due to the focus on the coronavirus pandemic, and we welcome this very much. We acknowledge the progress reported by Statistics South Africa in relation to the status of women's health in South Africa. Evidence from selected indicators 2022 show that the rate of HIV positive women who were already on ART at their first antenatal visit increased in all provinces and at national level. The rate increased from 61.7% in 2018 to 71.5% in 2020 in the country. To have a sustainable healthcare system, it is critical to have adequate human health capabilities. And to improve our health outcomes, we require well-trained health practitioners. The quality of health services has a direct impact on the extent of medical legal cases. These medical legal cases have a negative impact on the fiscal position of the department and undermines other prioritized programs. We need to ensure that our higher education institutions should expand the health faculties to produce more doctors and other healthcare specialized skills, including for various specialists. We acknowledge and commend the strategic international cooperation, such as the Nelson Mandela Fidel Castro Medical Program, which was established in 1996 by President Mandela and President Fidel Castro of Cuba. We should expand and improve the quality of training of nurses as a special emphasis. And despite the challenges in our healthcare system, we should know that the 2021 General Household Survey by Statistics South Africa reported that 72% of households said that they would visit public clinics or hospitals or other public institutions, while 27% would first consult private healthcare services. This makes this NHI bill so much more imperative for the sake of the people who need to receive services, healthcare services within South Africa. We have made progress in our priority of fighting crime and corruption. The Special Investigating Unit submitted its final report on its investigation into COVID-19 related contracts. As a result, 45 matters with a combined value of 2.1 billion rand have been enrolled with the Special Tribunal. 224 government officials have been referred for disciplinary action. 386 cases for possible prosecution to the National Prosecuting Authority. The department's entities such as the Compensation Commissioner for Occupational Diseases in Mines and Works, which compensates pensioners, ex-miners, and compensation for TB, has been adequately supported by the budget. The Council of Medical Schemes as an entity of the department, which ensures beneficiaries of medical aid schemes are protected and to work towards creating an equitable, cost-effective, and low-cost services is worth mentioning. And the entities under the department have performed well to the expected standards, though they experience limitations, especially financial limitations. Restrictions have been lowered through ending the national disaster as it relates to the health pandemic. This is a necessary intervention by government to balance protecting lives and livelihoods. The economy must return to optimal productivity. We know that the threat of the virus continues to persist. The fifth wave is imminent as we draw closer to our winter season. We are currently having over 63,000 active cases, and infections have been increasing daily, and this calls for special vigilance. We make a clarion call to all South Africans to maintain all required health protocols. To those who have not taken the critical step of vaccination, we urge you to be vaccinated, as this will protect your life. Scientific evidence and experience in our nation has proved that vaccines save lives. The drastic decline in mortality due to the coronavirus is testimony to the significance of vaccination. And finally, Chairperson, the Portfolio Committee had undertaken an oversight visit to the New Somerset Hospital after the shooting incident at the hospital. We thank and commend the management and staff for their prompt and appropriate response to the incident. We extend our condolences to the family members of those who have lost their lives. We dip our banner in honor of the brave member of the SAPS life and the nursing sister Diane Seal, who put herself in harm's way to intervene at the time. We support this budget vote because it recognizes the fiscal constraints through a balanced distribution of allocations to different programs and entities. Thank you very much, Chairperson.
Thank you, Honorable Dr. Jacobs. We now proceed and invite the DA, and the speaker is the Honorable Clerk.
Thank you, Chairperson. Many South Africans are asking themselves if their government is a lost cause. When we analyze the Health Department budget and the state of healthcare in South Africa under the ANC, we can see why South Africans feel that way. Fraud, corruption, and maladministration has become the order of the day under the ANC governance. And the Health Department is a clear demonstration of how fraud, corruption, and maladministration has destroyed public services for the poor. The health needs of the South African people exceed the capacity of the Health Department. And after 28 years, it is clear that this government does not have the ability to fix it despite massive spending. What they have delivered is one of the highest inequality rates in the world. This too has a massive strain on the health system. The lack of adherence to procurement processes has been the biggest contributing factor to COVID corruption. And what South Africans saw was repeated instances of grand theft of public funds by those entrusted to serve the citizens of South Africa. They knew no boundaries and continued to loot COVID-19 pandemic emergency funding without any remorse for those dying of this deadly virus or the millions who had lost their lives due to lockdown, who had also lost their livelihoods due to lockdown. After what we saw with COVID corruption, can we honestly say that we have a caring government or a government that cares about the poorest of the poor? The SIU had investigated 5,467 contracts awarded to 3,066 service providers with a total value of 14.3 billion rand. Investigations into 4,549 contracts that had been finalized, of which 2,803 were found irregular. This means that 61.2% of all procurement was irregular. Within Program 2, an amount of 8.8 billion has been allocated to the NHI. Considering the massive irregularities and procurement and high risk of mismanagement of funds, 8.8 billion rand of taxpayers' money being allocated to this program will be at risk to fraud and corruption, as this program has historically underspent and is primed for looting. The NHI should be scrapped in its entirety. The funding should be used towards solving the chronic problems in the sector, such as infrastructure and skills development, as well as ensuring that hospitals are capacitated to supply quality universal healthcare to all citizens within South Africa that depend on state healthcare. Considering the shortages of funds, we are already experiencing severe impacts on health infrastructure, filling of vacancies, offering of high-end care, waiting times at clinics and surgeries, availability of medication, and the affordability of NHI. Since the initial costing of NHI bill, we have experienced a pandemic, economic decline, and millions of job losses. South Africa's tax base has shrunk. A shrinking tax base highlights the increasing concerns regarding the NHI's unaffordability now more than ever. Government needs to strengthen its health workforce. It has become critical. The budget for nursing services program is only increased by 1.3% in real terms. Considering that the vacancy rate of nurses is 21,453 and the vacancy rate for specialist medical personnel is sitting at 602, it is clear that the budget for the development of required nursing and specialized skills is not enough. The current ratio for doctors to patients is 0.31 per 1,000 residents, down from 0.79 per 1,000 residents in 2019. It is clear that South Africa has a dangerously low number of medical health practitioners, and with the implementation of NHI, as well as the mass immigration we are experiencing, it will just get much worse. Despite these shortages, nurses have been left out of the critical skills list. All these horrific shortages of medical staff have a huge impact on the kind of healthcare the department provides. On a daily basis, I get calls from desperately poor South Africans seeking help because family members that are in state healthcare facilities are not being taken care of. On Saturday, I had a call from a community member asking me to assist her. Her mother was admitted to Tembisa Hospital early March with liver failure. Her condition was regressing, yet the family had no feedback from the doctors taking care of her. I was getting in touch with the CEO of the hospital and received a call from Entel to inform me that her mother had passed away. It is heart-wrenching that families are not informed time and again of their loved ones when in distress in state hospitals, as they simply do not have the nursing staff, doctors, and infrastructure to provide decent healthcare due to budget cuts. Government must significantly ramp up the development of nursing and medical health professional skills in South Africa. The NHI will ultimately fail to provide equal access to quality health services under these conditions. It will become another failed SOE. The health department's attempt to repurpose universal healthcare into the NHI will become yet another cadre enrichment machine, as we've seen within Eskom, Denel, and the likes of SAA. Be warned, ANC, the trust within government is declining. The country is at the beck and call of crooks, and denouncing corruption, Mr. President, will not work if these crooks do not find themselves in orange overalls. South Africans are not fools, and there's a growing impatience in our country. Be warned, ANC, your days are numbered within government. I thank you.
Thank you, Honorable Clerk. And now from the EFF, I don't have a name, but I've seen Honorable Teza. Is that you?
It's Honorable Dr. Tembe Kwayo.
Honorable, didn't give me. Thank you. Proceed.
Thank you, Chairperson. Greetings to all the leaders of the EFF, officials, commissars, fighters, and ground forces of the only movement committed to the well-being of our people in the country. We are here today, 3 years since the COVID pandemic struck us and exposed the rot in our public health system. During this period, all of us learned the depth to which the leaders of the ruling party are prepared to go to pursuit of their self-enrichment goals, completely disregarding the health of the majority of our people. Chairperson, over 84% of the people in this country do not have medical insurance and are therefore dependent on public health. The past 3 years of COVID pandemic have exposed that we do not have a public health system in the country. While nurses and doctors in public hospitals were crying for protective clothing at the height of the COVID pandemic, Mr. Zweli Mkhize was busy devising plans to enrich himself and his family from the pandemic. Repeated cries for a more compassionate government from the public servants, such as the heart-wrenching letter written by one nurse from SS Gida Hospital in Keiskamahuk, Ms. Monica Mbeu, who decried lack of protective clothing for health practitioners, received no attention in the public health. This budget today indicates that there is no appreciation of the depth of the rot in the public health system. It is certainly a reality that the country's public health care system is plagued by with leadership of the ANC. If it's not the blame everyone, but the who is who in charge, Aaron Motsoaledi, the sticky fingers of Zweli Mkhize, it is the permanent state of slumber and laziness of the Minister Joe Phaahla. Minister has been in slumber from his days as Deputy Minister knowing nothing, accounting for nothing, depending on chairpersons of portfolio committees to hide his incompetence under the guise of political allegiance and loyalty. Here we have minister who to date has led the country to a worse state of healthcare as yet. His entities are plagued with racism and sexism as encompassed by the NHLS, who abuse Black women senior scientists, Mposileka being one of them, and blatantly refuse to account. We have SAPRA, which in his constant state of lies and deception, mumbling over what they are saying, over what they are doing. 2 years later, and SAPRA has still not done the work to save and protect our people from Johnson & Johnson surgical mesh debacle, because they eat Bill Gates' money and would rather have women like Pindile Mncube be left with no choice but to completely remove their wombs because of toxic transvaginal mesh devices. While they do this, SAPRA is dead set against approving vaccines developed by companies from Russia and China. They are gambling with the health of our people in pursuit of factional scientific preferences. The CEO of Steve Biko Academic Hospital unreservedly denied taking in the victims of forced sterilization of Black women whose wombs continue to leak because the government of the ANC saw it fit to continue with eugenics on the bodies of Black women. And I don't blame her. She has been supposedly waiting for a go-ahead from the department and the minister, who is obviously sleeping on the job and knows absolutely nothing about the current state of the department he is leading. Infants are dying. New mothers are dying. Patients are starving in hospitals. We have a shortage of doctors and nurses, while thousands sit at home unemployed. Hospitals are burning. Equipment in tertiary hospital is not being serviced or replaced when damaged. Women continue coming to hospitals with healthy pregnancies and living with disabled children because you have ran public healthcare system to the ground. We need free, universal, and quality healthcare for everyone. We need to train, employ, and remunerate properly all healthcare workers in the country. We need to have public hospitals that are up to the task of servicing the health needs of the 86% of the citizens of this country who can't afford medical aid. This budget is business as usual type of an arrangement by a government that has no clue of what we are dealing with. The EFF will never legitimize this department and its lazy minister. We reject this budget. Thank you.
Thank you, Honorable Tembagwayo. As I call on Honorable Hlengwa, I will allow Honorable Danji to proceed with the speakers list. Honorable Hlengwa. Ma'am Hlengwa.
Thank you, Honorable Chairperson, honorable members. Healthcare in our country finds itself in extremely difficult point. Even before the event of the COVID-19, our public health resources and infrastructure were not equal to the task of health provision in the country. It is in very respect, South Africa remains unequal in provision of health care, which is a universal and constitutional human right. In addition to this pressure, our healthcare service must be conducted with several regional and global challenges, such as illegal foreign nationals, escalation humanity and emergence, climate change, and environmental degradation. Most important, we are not over the COVID-19 crisis, And as we are about to enter this winter season, we are already noticing an upwards movement in respect of positive COVID cases. This will place our public health care system under renewed stress, which may last for the next decade. And which is why it is very important that we build a resistant and effective healthcare system. As a part of resistance build, we must ensure not only human resources such as our medical professionals, doctors and nurses, but also medical equipment equip all areas in South Africa. Why does the HPCSA still make it so difficult for our for our foreign qualified medical doctor to enter professional medical practice in South Africa? Given that we currently have vacant posts of 1,339 doctors, what are we doing to prevent our medical professionals from leaving South Africa to practice medicine in other countries? We have 10,800 vacancies for nurses. Why are these shortages of medical cancer treatment in our rural areas? Why do our public hospitals continuously run out of necessary consumables like antibiotics, clinics, etc.? In such a time, why do we not have sufficient capacity in respect of mental health care facilities? And why are we not using this period? We are also heavily reliant to technology to medical innovate in our healthcare field. How are we in providing our public health care ICT, ICT capacity? And what are we doing in order to ensure that all of our hospitals and clinics have alternative electricity capacity? As I think we can all agree that ESCOM has truly failed us, and it is only going to get worse. Chairperson, audit outcomes of KwaZulu-Natal and Northern Cape provinces require immediately intervention, as there has been little or no improvement over the past 5 years with these health departments, whose audit remain qualified. Unauthorized expenditure, fruitless, wasteful expenditure, and the high in the Eastern Cape and Gauteng. Why is this so? Let me tell you, Chairperson, it is because there is no consequence management. Department officials can do they please and discard tender and procurement regulations. Chairperson, it is criminal that health infrastructure projects are delayed due to mismanagement and poor oversight and project management, especially given to unequal distribution of health infrastructure in our rural areas. In conclusion, Chairperson, healthcare must be prioritized by the government, and the digital transformation of the public healthcare system must be embraced in order to innovate, transform, and build resilience into the sector. Universal access to healthcare must be available to all South Africans, and the NHI must be implemented in the model that financial sustainable and achievable. The IFP support the budget. I thank you.
Thank you, Honorable Member. I'm feeling like Klasa taking over from Honorable Janji. Can I now call the next speaker, Honorable Van Staden from FF+.
Thank you, Chairperson. Met 'n totale begroting van 64.5 miljard vir die 22-23 finansiële jaar, is hierdie regering en hierdie departement veronderstel om van die beste gesondheidsorg aan Suid-Afrikaners te lewer. Maar wat gaan weer soos die vorige finansiële jare met hierdie gelde gebeur? Dit gaan weer gesteel word. Die ANC-regering en sy magsbehepte maatjies gaan maar net weer hierdie fondse plunder en steel. In November 2020 het hierdie departement gebuk gegaan onder 'n korrupsiestorm van nagenoeg 14 miljard rand. Die spesiale ondersoekeenheid het 224 regeringsamptenare verwys vir dissiplinêre aksies wat teen hierdie amptenare geloods moet word, en 386 sake vir moontlike vervolging is verwys na die nasionale vervolgingsgesag. Die Digital Vibe saak en die betrokkenheid van oud-minister Zweli Mkhize is 'n baie mooi voorbeeld hiervan. Die probleem is egter dat meneer Mkhize nog absoluut geen verantwoording gedoen het nie en nog steeds in hierdie parlement sit is 'n ANC LP. Weens die swak dienslewering wat plaasgevind het in die openbare gesondheidsorg, het die ouditeur-generaal bevind dat daar 'n aansienlike stygings was in regseise teen die departement. The Auditor General also expressed concern regarding increases in unauthorized, irregular, fruitless and wasteful expenditure, and I quote, due to disregard for legislation, close quote. How is it possible that ministers, government officials and the departments constantly disregard legislation and do not obey the law, but nothing is happening to them? Because they are protected by a corrupt ANC government. It is time to send the ANC home. Op infrastruktuurprojekte word dit in die verslag aangedui dat daar 'n aansienlike vertraging is in die lewering van projekte in sommige provinsies. Verder word ook daarop gewys dat sommige provinsiale departemente nie daarin geslaag het om projekte doeltreffend te bestuur nie, wat gelei het tot potensiële vrugtelose en verkwistende uitgawes van nagenoeg 18.5 miljoen rand. Dit is geen wonder dat die probleme by die Charlotte Maseke Hospitaal in Johannesburg die afgelope tyd gesorg het dat die hospitaal nie betyds sy deure na die brand kon heropen nie en gelei het tot die gemors in Gauteng wat ons die afgelope ruk sien afspeel het. Dit was skokkend om te verneem dat hierdie projekte vertraag word deur bougehalte tekortkominge, swak bestuur van mylpale en mikpunte, swak prestasie van kontrakteurs, swak beplanning deur die provinsiale departemente, swak projekbestuur en swak vakmanskap. Die VF+ trek 'n verslagdoening vanaf die departement in twyfel wat beweer dat daar die afgelope finansiële jaar 40 fasiliteite geboue en herstel was, dat 21 hospitale gebou en herstel gaan word en dat 'n verdere 120 fasiliteite opgegradeer gaan word. Die portefeuljekomitee het die afgelope jaar verskeie hospitale reg deur die land besoek en elke keer het die VF+ die swak infrastruktuur en instandhouding van die betrokke hospitale tydens hierdie besoeke uitgewys en beklemtoon. Dis die departement se beloftes dat hulle gaan fokus op die opknopping, opgradering en bou van nuwe hospitale, gesondheidssentrums, klinieke en nuwe gespesialiseerde eenhede, insluitend onkologie, sal geglo word wanneer die portefeuljekomitee dit self kan sien, maar tot dan bly dit maar net beloftes. Die onsekerheid bestaan ook of meer fasiliteite gebou gaan word vir geestesgesondheidspasiënte wat op hierdie stadium broodnodig is, aangesien die tekort aan hierdie fasiliteite daagliks groter word en daarin nog 'n life epidemie tragedie mag plaasvind. The registering of 59 million people on the health patient registration system as reported is not an achievement achieved, but rather a copy and paste of a population register. No achievements here at all. The decline in routine services the past 2 years is a big concern, and we receive on a daily basis more and more complaints from patients who are still waiting since March 2020 for their hip replacements to be conducted, but due to the government's COVID-19 regulations, these patients are now in constant pain and still awaits their operations. It is no wonder that diseases like TB and measles are getting out of hand. Matters like these are some of the reasons why the FF Plus submits its comments against the proposed health regulations and ask for the withdrawal of these regulations and not to promulgate it into law. The public outcry against these regulations demonstrates that there is a widespread opposition to the regulations, and the FF Plus is of the opinion that the amendments come down to nothing but the transfer of power from one minister to another. In this way, the ANC is trying to maintain its abuse of power. It is time to send the ANC home. Verder word geld wat nuttig kon gebruik gewees het in die aanstelling van verpleegsters en dogters, die betaling van verkryging van medikasie en broodnodige mediese toerusting en die uitbou van infrastruktuur vermors en gestort in die bodeloomse put van die nasionale gesondheidsversekering. 'n verdere 8.8 miljard rand word weer in die NGV gestort. Die regering en departement het geen plan in plek om die vakante poste van verpleegsters en dokters in staatshospitale uit te wis nie. Intussen word miljarde rande gestort in 'n stelsel wat poog om alle private gesondheidsorg in Suid-Afrika te nasionaliseer, in plaas daarvan om daardie fondse eerder te gebruik om meer verpleegsters en dokters aan te stel en die tekorte van mediese toerusting en medikasie uit te wis. Daar moet 'n bietjie bepaal word hoeveel hospitale en klinieke kon al gebou gewees het met al die miljarde rande wat reeds in die bodeloomse punt van die nasionale gesondheidsversekering gestort is. Die VF+ kan nie begroting ondersteun wat deur die ANC regering gestort gaan word in 'n bodeloomse put van nasionalisering, korrupsie, wanbestuur, wanadministrasie en blote diefstal van fondse. Dankie voorsitter. Ja, maar ek het nie gehoor nie. Baie dankie.
Thank you. Honorable Sekers from ACDP.
Thank you, Honorable Chair.
Yes.
The ACDP wants to extend our sincere condolences to the families of the patients who lost their lives in the shooting incident in Somerset Hospital. To the family of young Constable Danae Phillips, who lost his life in the line of duty, we want to express our deep sorrow for your loss. Your loved one is among the hundreds of men and women who answer the call to service and who in doing so pay the highest price. A grateful and humbled nation thanks you. On Saturday, nursing sister Diane Seal showed strength of character in the face of real danger, and in so doing, gave us a lesson to emulate. Crises require strong leadership, and that what is in you is revealed under severe pressure. Sister Seal showed us, in the words of the chair, Dr. Kenneth Jacobs, yesterday, that you can truly fight a war with nurses. This incident is evidence of a health sector that is in a permanent state of crisis. And therefore, we must emphasize to the department and the minister the need for competent strategic leadership to get beyond constant crisis management. That this level of leadership is not provided is evident because we see that frontline health workers like Sister Seal have to display heroic leadership qualities, whether that is everyday decisions or facing down armed assailants entering what is supposed to be a safe place of healing. Patients and frontline workers can't trust that they will be safe in your facilities. And the over 300,000 submissions that has been submitted on the new regulations on notifiable diseases indicates that the people of South Africa do not trust this department with any aspect of their health. That trust can start being rebuilt by the Portfolio Committee, showing that it is holding this department accountable for the 58 billion rand that the people of South Africa had allocated to it. The Auditor General points out some of the department's strategic plans as ambiguous and misaligned. The research capacity of the Portfolio Committee should be expanded to allow the Portfolio Committee to do proper oversight of the departmental strategy so that these flaws can be fixed. To see how that, albeit flawed, strategy is executed on the ground, the committee has been asking the department for the last 2 years how it will hold provincial departments accountable. We are none the wiser today, Chair, and the question should be asked, is the national department merely a bank? And if so, why does it need such a large staff? The committee needs a regular schedule of engagement with the provincial health departments in order to monitor them, and the department needs a more rigorous and time-based accountability model to monitor the provinces.
Your time is up, Honorable Member.
Thank you, Chair.
Time up. Thank you. Honorable Deputy Minister for Health.
Thank you very much. Thank you very much, Chair, for giving us this opportunity. Greetings to the Minister, Dr. Joe Pasha, the Chairperson of the Portfolio Committee, and all the members of the Portfolio Committee, ministers who could be logged in, deputy ministers, heads of public entities that we work with, distinguished guests, government officials, ladies and gentlemen. We'd like to start by saying what the minister has actually tabled. We support this budget of vote 18 for health so that we could be able to give and support South Africans the way we have done in the past in dealing with the quadruple burden of disease and many other emerging diseases that we do find. We note that even during this COVID pandemic, which came in, it greatly disrupted some of the health services that we have been providing to our country. Hence the call by the minister that let us now and all the other programs that we actually have really been doing: hypertension, diabetes, cancer, mental health. Those are non-communicable group of burden of disease that we need to actually work on. We should actually point out here, Chair, that over 80% of these commonly experienced non-communicable disease are actually preventable. And yet we still find quite a lot of that not being adhered to. We are actually grateful, however, as part of going back to these programs, the minister is planning to relaunch the campaign on the non-communicable disease, not very far from the time that we are having today. On the current MTSF 2020-24, we're giving ourselves a target of 25 million South Africans to be screened annually for high blood pressure and diabetes. We would like to actually commend and thank our healthcare professionals out there because we have really surpassed the target. We have actually last year did 29 million screenings for high blood pressure and over 28.7 million for diabetes. However, what is important is what happens after screening. Do we actually take those for diagnosis and therefore treatment? Because if you then screen but don't treat, is not actually adequate enough. We want to actually indicate the progress that has been made significantly by the department through all provinces on our flagship program called Central Chronic Medicine Dispensing and Distribution. This is going on in 8 provinces, over 46 districts, and with 3,500 public health facilities. We would like to actually, in this regard, just indicate to you one a lady that I met in Nongoma eduze kwasehlalankosi uthi wedokotela uDlomo lento yokuthi silanda amaphilisi eduze kwasemakhaya ethu sihlala kuona isisize kakhulu. Asisadingi ukugibela amatekisi, sigibela amabhasi, sengikwazi nokunikeza umntwana ikhadi lami lokuthi mebuye esikoleni adlule crash lapha yana ngithola khona amaphilisi abese yangithathela khona. Isisize kakhulu leyo nto, ngeke sisashodelwa namaphilisi, asesayi naseyibhedlela emakliniki yonke izinyanga, siya kanye ngonyaka, siya kanye emva kwenyanga ezine. Leyo nto ke iyasisiza siqhubeke nemisebenzi yasemakhaya. Leyo nto ke ishiwo over 5 million South Africans, that the total of 5.1 million patients have enrolled in this program since its inception in 2014-2015, and it grows at about 750,000 per year, and we actually do good savings. On the issues of cancer programs, we actually focus on the 4 main areas, which is cancer oncology, the buying of the linear accelerators, the nuclear medicine radiotherapy equipment rollout, the CT scan, and cancer brachytherapy. Now, I'd like to indicate that there's been money that will be spent on these programs. Over 257 million has been allocated in the NHI grant to 6 provinces to support their oncology services. The one will be the Eastern Cape, where there will be improvement on Livingston and Ferry Hospital by supporting them with the replacement of linear accelerators. KwaZulu-Natal, 20 million will be allocated for the outsourced programs of oncology around Gwelezane area. we need to continue having the outsourcing programs of Limpopo, Mpumalanga, Northwest, because if we don't, they continue having an impact on the central hospital in and around Gauteng. We also would like to say there is a very important program that the department has been embarking on, which is started on 2017, that of focusing on HPV vaccine. That program is done in all our primary schools at about 9 years of age of girls. To date, since 2017, 1.5 million doses have been given to our girls as a first dose, and the 1.35 as a second dose to the grade 4 or grade 5. Now, we have had a slight disruption with the COVID-19, but however, that actually is going to accelerate now and increase in a very big way. We also focus on other cancers, not only these ones that I've just mentioned. According to the World Health Organization, the COVID-19 pandemic has had a major impact on people's mental health. Some groups, including the frontline workers, students, and those with pre-existing mental health conditions have been heavily affected. Now, we actually indicate that the common mental health problems like depression, anxiety, and alcohol and other substance abuse will make it difficult to adhere to life-saving medications for chronic conditions. But however, there are programs that are done in the Department of Health. The department will be scaling up the mental health promotion, prevention, and treatment and rehabilitation to actually make sure we cover and focus on this. An additional 600 healthcare professionals will be trained this year. In fact, and also we will actually improve on our mental health infrastructure. Malaria is a potentially life-threatening disease caused by blood parasites. We have just commemorated the World Malaria Day 2 weeks ago in Mangweni community in Nkomazi municipality, province of Mpumalanga. This was part of the ongoing effort to raise awareness about malaria risk. Now, Honorable Minister Phahla is a chairperson, current chair of the E8, Eliminate Malaria in SADC. Now, it means there's an expectation that as South Africa must do better and faster than the other countries in SADC. And this is why we are actually pleased by seeing decreasing number of cases, new cases of malaria, decreasing deaths in the 3 main provinces where this is actually a burden. But okay, as South Africa, we need to, among other things, champion the cross-border initiative of actually making sure malaria can always cross the border. So it's not only looking inwardly, but also assist the neighboring countries, Eswatini, Mozambique, Botswana, and the other countries that we are nearby to. We'd like to indicate that we are very pleased with the progress that we have made in partnership with Home Affairs in terms of the birth registration in our health facilities. There's 391 health facilities, mainly those with a high volume of mothers delivering that have benefited from this program. Just 3 weeks ago, with the Deputy Minister Nzuza, we were in Newcastle to actually open 1 more site. Over 1 million deliveries are done annually in our public health facilities. And these are the mothers who therefore now do not have to queue in the Home Affairs offices, but while they are breastfeeding on the bed, and then somebody comes in on the bedside and leave them and give them this birth certificate that has already been generated in our hospitals. We could not have gotten this during those days. It is now a caring government that can only do that in our days. I have been given a permission by Minister Phahla to go to Cuba next week to avail, among other things, to really look into the monitoring and evaluation of our program, the Nelson Mandela Fidel Castro program, this program that has actually given us this one day. Just a few weeks ago, I was in Mthatha and I met a specialist doctor in the most poorest district, OR Tambo, and he says to me, Dr. Lomu, we are very proud to indicate that this training that we have done has increased the capacity of medical doctors who are placed in the most rural hospitals and clinics. Right now, here at Tafalo Fair, a place that maybe a lot of other members logged in here don't know where that place is, can now claim to have doctors who actually are supporting them. From the inception of this program to March this year, we have produced 2,556 doctors, some of whom are now specialists. And this is actually a great achievement. On the public entities, we are an envy of Africa and envy of the world with the work that has been produced by National Health Laboratory Services. Over this period, they've actually done 11 million tests on COVID. 8 million of those were on PCR and 3 million were on the antigen rapid test. Overall, annually, they've actually done 24.6 million tests of all other various tests that we actually need as a country, and with the amount of 8.8 billion that actually have come in there. So they continue to work very well with the National Institute for Communicable Disease, and I'm sure you are pleased with all the daily figures that we see coming through there. I think what was raised by Honorable Thembekwayo, I would like to get some information to assist in terms of what she picks up as an unhappy statement with regards to NHLS. On the SAPRA, we can actually say to date, with high expectations that have been there from South Africa, they've been able to actually register 3 drugs, Pfizer, J&J, and Sinopharm, and they continue to also have a Sinovac, which is under emergency authorization. So that process is actually commendable. Yes, if there are challenges, we always want to address those challenges and support them, including the work that was done by South African Medical Research Council, supporting us with the Sisonke study, because it was that type of a study that was the precursor of us being able to get vaccines into our country, initially to our healthcare workers. We are proud of something that is remarkable that was achieved by the Council for Medical Schemes, where they intervened when they registered the complaint to the Competitions Commission about the high price of the COVID-19 test that were done. The intervention resulted in a price reduction of the price from 850 to 500. And this is reflecting of a 40% difference. Much more could be done if we continue to do such programs through Council for Medical Schemes. The Office of the Health Standard Compliance continues to be a watchdog for strengthening health systems, and we welcome them in all what they do, because they really are pushing that hospitals must really look like hospitals. Clinics must really look like hospitals, like clinics. The smell in the hospitals and clinics must really be like that we know of a smell of a clinic. Because that, if we continue to focus on this, it will definitely bring credibility to the call that is made of the National Health Insurance. We also want to continue to indicate that we continue as a department to work with the Statutory Health Professional Councils, HPCSA, Nursing Council, and actually the Pharmacy Council. On the Medical Bureau, the Minister has led us to visit Eastern Cape, Mozambique, and other countries, working together with the Mineral Council of South Africa in terms of the programs that are there in actually compensating the former mine workers, which is something that is extremely important for their social protection and benefit. In 2 days' time, we'll celebrate the International Nurses Day with the theme, A Voice to Lead, Invest in Nursing and Respect Rights to Serve Global Health. The heroic display by the matron at New Somerset Hospital, where she put total health of her patients before hers, confirmed that we still do have in our country nurses whose spirits who actually adhere to the spirits of Florence Nightingale, Cecilia Matuane, and Meredith Luhana. We would want to say we would continue to support our healthcare workers despite the challenges that they face. Let me then say to Honorable Dr. Thembekwayo, I will be forwarding to the chairperson of the Portfolio Committee of Health, together with my minister, a dossier that I've prepared with regards to what she raised about Ms. Pindile Ncube. I have done everything humanly possible. I have referred her to the best of specialists in our country at Inkosi Albert Luthuli. They've done everything humanly possible to attend to her problems, but let me not expand that until you see that dossier that I've prepared, dating back from the time I have seen and referred her to Steve Biko Academic, referred her also to Inkosi Albert Luthuli, and all that they've done. Honorable Chairperson, we would work hard, we will continue to work hard towards building a resilient health system, since this is a prerequisite for the National Health Insurance. And based on the lessons learned from the COVID-19 pandemic, We have also been preparing to integrate provisions of health services and harness our human and institutional capacity to deal with the non-communicable and communicable diseases, including the COVID-19. I thank you, Chairperson.
Thank you, Honorable Deputy Minister. Can I now call a representative of COPE? COPE? Well, I can't see them. Can I now call Honorable Ishmael from the DA? Honorable Ishmael, yes.
Thank you, Chair. The opening demand of the Freedom Charter states that the people shall govern. 28 years into democracy, I am sure that the writers of the Freedom Charter never dreamed that under their own ANC, the health services they dreamed about would be so dysfunctional. The past 2 years have been harrowing for most South Africans, who have experienced loss on a scale and magnitude that is almost unfathomable. If not for NPOs, NGOs, FPOs, and the private sector providing extra resources and expertise, we would not have come out of COVID-19 as we did. Despite government telling us that they are pro-poor, it would seem that the opposite is in fact the case. The AG has given advice that there is no improvement in governance, procurement, and project management with huge irregular and unauthorized expenditure. As a result, the poorest of the poor bear the brunt of the abysmal management of our health systems. In the last 2 years, the SIU has uncovered 45 matters to the value of 2.1 billion rand, which have been referred to the special tribunal. 224 officials face disciplinary action, while 386 cases have been referred to the NPA. This was money stolen from a system that should have uplifted health for the poorest and most vulnerable. But the fish rots from the top. Massive shortages of staff in critical skills, which do not even appear on government's most recent critical skills list, have resulted in shattered and exhausted nursing staff at most facilities. Outdated staff structures, surgical backlogs, questionable disposal of medical waste, mismanagement at every level, and non-payment of suppliers have led to a constant decline in health service delivery, with the poor and vulnerable feeling the effect and paying the highest cost. South Africa currently has a vacancy rate of 18.6% for specialist medical personnel and 13.7% for nurses. Yet, community service doctors and nurses are waiting to be placed. How can we possibly deliver quality healthcare when there is such a shortage of staff? And those that are lucky enough to have a job are exhausted and overworked. Were it not for the dedication of South Africa's healthcare workers overcoming tremendous odds, many more thousands would have succumbed during the pandemic. The Democratic Alliance thanks you for your compassion, courage, and hard work. Mental health issues are on the rise due to COVID-19, joblessness, starvation, and hopelessness. There are, however, insufficient facilities to assist individuals with mental health problems. Facilities are crumbling, but 18.5 million rand has been wasted due to mismanagement of projects. New builds are plugged with poor quality building standards and a myriad of deficiencies. These must now be rectified on the taxpayer's bill and at the cost of the poor and vulnerable. The OHSC are understaffed. Currently, only 8% of public healthcare facilities are evaluated and monitored for compliance. Alas, the poor and vulnerable pay the brunt. The health system is in a crisis and on its knees. Act now or pay the price. I thank you.
Thank you. Can we now call Honorable Gela from the ANC? Honorable Gela.
Ndiyabulela mhlali ngaphambili. Ndibulele nereport esifumeneyo kuMinister wezempilo. The Department of Health manages a large healthcare system which support the majority of South Africans. We applaud the Chris Hani Baragwanath Academic Hospital for its Gold Award and the Gauteng Province for the Silver Award. The healthcare sector in South Africa has been assessed and evaluated, and numerous reports have reflected the challenges in the sector and required interventions, which, as the 2018 Presidential Health Compact, it committed stakeholders to contribute through the 8 pillars, which focuses on improving the quality and efficiency of our healthcare system. The National Development Plan describes it as a problem of the performance of our health system, despite a health expenditure at 9.1% of the gross domestic product. We bring to the fore the quality of a health expenditure and whether the health system is producing health outcomes which are equally to the spend. Through the National Health Insurance ANC policy, government seeks to address the market insufficiency which provide quality healthcare for a few, which results to a misallocation of resources in the health system. All stakeholders should continue to play their role as per recommendations of the Presidential Health Summit. We support the budget vote because its allocations respond to the policy priorities of the National Development Plan. The budget support the important programs of the vaccination rollout. In the previous budget, the department committed that it will secure enough vaccines for all South Africans. Our government has realized that we should vaccinate to protect ourselves and others. In our engagement with the South African Health Product Regulatory Authority, the entity demonstrated its efforts in ensuring that health products are timelessly authorized, and they monitor and evaluate the clinical trials. Our regulatory body demonstrated diligently during the pandemic, and the current budget support initiatives of strengthening the information management system of the entity. We have called the SAPRA to strengthen its relationship with the Department of Science and Innovation to support innovation and development of pharmaceuticals. We welcome the entity's effort on continuously partnership with international regulatory and the World Health Organization. This strengthens the system which help maintain world-class standards. We have also recommended the promotion of indigenous knowledge system to provide support of IKS initiatives as part of the science and innovation ethical plan. We need to harness the nation's wealth of knowledge and experience. Without effective regulation of the health consumable equipment political economy, the cost can be exorbitant, which will shrink the capacity of our health budget, and other instances, it makes a certain medicine to be not accessible for the poor. It is for this reason the resolution of the African National Congress on establishment of a state pharmaceutical company. The state has established Kitla Pillar to improve the security of supply for barren diseases by local manufacturing the main active ingredients in South Africa. This is an important establishment which become a critical player in future figuration of the health political economy. The President Cyril Ramaphosa has urged all countries to support a waiver of the trade-related aspect of intellectual property rights, which are known as the TRIPS agreement at the World Trade Organization. This call is consistent with transformation the health political economy. Another critical entity in our health system is the South African medical research, which demonstrated during the coronavirus pandemic that research development in an important capability of a nation. In this medium term, the entity aims to ensure that 200 journals, articles, and books chapters are accepted and published by authors affiliated and or those funded by council. We applaud our scientists who have lived the true expectation of using science and respond. And we applaud our scientists who have lived their true expectation of using science to respond to the humanitarian threats caused by disease and viruses. South African scientists have positioned the country amongst other nations of the world. Our researchers has shaped the global response to the pandemic. Statistics South Africa reported the Gauteng recorded a higher proportion of adolescents who visited mental health facility in 2019 and 2020. Eastern Cape, Northern Cape, and Limpopo had a lower proportion of adolescents who visited a mental health facility for both reporting years. This signifies the importance of mainstreaming mental health across our health facilities. We have observed a relative lack of support for mental health related issues. We implore the department, drawing from the lessons of implementation of the National Mental Health Policy Framework and Strategic Plan 2013 to 2020. The current mental health policy framework to be tabled this year should enable a substantive budgetary allocation for new mental health facility beyond psychiatric services. All these programs have a direct impact on the lives of South Africans, and we should build on our strengths and address weaknesses in the system through this budget. The African National Congress support budget vote 18 on health because this vote urges us closer to realize the provision of quality universal healthcare. Of course, Chairperson, we understand Guti, the opposition will never support our budget. And the Minister Bayeke Bakonkote
your time has expired.
Next time Uzuti signifies. Next time Ungathi signifies. Ibethe ngesixhosa kaloku. Yenze ngesixhosa. Yenze ngesixhosa qha bekanye. Yeko signifies.
Honorable Cesar, please. Can I now move to the next speaker, Honorable Sheikh Imam from the NFP?
Thank you, House Chairperson. The National Freedom Party will support Budget Vote 18, held tabled here today. Allow me to start off by reminding our colleagues that Thursday, the 12th of May, will be International Nurses Day. And we call upon the Minister and his department to closely investigate the working conditions of nurses in hospitals and clinics across the country. Some of the conditions that nurses are exposed to are appalling. It is a direct violation of their occupational hazard. Now, House Chairperson, having said this, many years ago in this particular house, I raised the issue of community healthcare workers. And there was an undertaking by the then President, Jacob Zuma, and approximately 1,300 Rand a month at this stage, and had no benefits after 30 and 40 years of service, will be made permanent with full benefits. While some provinces had started it, I think it under our Deputy Minister, KwaZulu-Natal had started the process, but the other provinces have been lagging behind, and that has not happened. The vacancy rate amongst healthcare professionals in the department is recorded at 10,800 nurses and 1,339 doctors, as previously raised. Now, having said this, House Chairperson, there is a lot of red tape, it appears, and in being accepted to serve the internships and things in the country. Now, given the fact that a lot of these doctors and experts are going to be required to ensure the success of the rollout of the NHI, should we not be looking deeper into to see how could we accommodate them, relax some of the conditions if necessary, of course not putting anybody at risk, so that we'd be able to successfully roll out the NHI. 21,000 specialist medical personnel posts remain vacant in all 9 provinces. Now, we welcome, some of the steps and initiatives that is being taken by the department. However, I want to raise concern that not enough is being said and done about vaccines in the country, as a result of which you would find particularly the younger population are not taking the vaccines. And we want to call upon the minister once again to create some avenue to communicate the method and get people to be more comfortable to understand that the vaccines will help to save lives. In the absence of that, people are reluctant to take the vaccine. And that's why you're having such a situation where most of the population is still not vaccinated up to today, posing a serious and great risk to others. The National Freedom Party will support this. Thank you very much.
Can I now call upon Honorable Hendricks from Al-Jama? Honorable Hendricks from Al-Jama. Honorable Hendricks. Maybe let's move to the next one. PAC. PAC. Let's move again. Honorable Wilson from DA.
Thank you, Chairperson. There is a proverb that says, and I quote, "There is no pillow as soft as a clear conscience." I wonder if any member of the Department of Health, from the Minister, his deputy, their cadres, or any other senior member, sleep comfortably at night. If you are, then certainly you do not have a conscience. And given the state of health in South Africa, I wonder. There are millions of poor people out there without food, water, or sanitation. They are jobless and without hope. To compound their very sad plight, we add to their misery by being unable to assist them or their families when illness strikes. The sad reality is not only do they not get assisted at our public health facilities, we often drive away any hope they may have had. Let's take the lady at Philadelphia Hospital who was left lying in labor for 4 hours because there was no theater available for an emergency cesarean. Eventually, her uterus ruptured and her unborn child died. Not only did you steal her hope, you took away her baby too. How do you sleep at night? The poor lady who died of septicemia at Steve Biko because of a leaking colonoscopy bag, causing massive infections to her wounds. No one helped her. She died long before her time, leaving a stricken family without hope. How can you sleep at night? The gentleman lying in hospital for almost a month with a gallstone obstruction, who had to wait until his blood levels were so extreme before they would book him a surgery. How can you sleep at night? At the Livingston Hospital, surgery came to a grinding halt when major medical suppliers refused to deliver to them because their accounts had not been paid. The only available water at the Lexitelli Clinic is from a borehole riddled with E. coli and bacteria because there is no budget for them to turn on the municipal taps. How can you sleep at night? It is little wonder that this department is facing over 100 billion.
Honorable Chairperson, point of order. Point of order.
Can I get what is the point of order?
Thank you so much, Honorable House Chair. House Chair, I want to ask the member that is she insinuating that the minister has killed people? And if that's the case, she's out of order because she can't say, how does minister sleep at night, almost if he killed people. That's out of order, Chairperson. Can you look into it and come back to the House?
Let me look into it and come back. Okay. Can we allow the member to continue?
Thank you, Chairperson. It is little wonder that this department is facing over 100 billion in medico-legal claims, almost as much as its entire year's budget. In the 2021 fiscal year, the Eastern Cape Department alone had to pay 920 million rand in claims. No wonder their accounts are not paid. The total payout for the 2018-19 claims was close to 2 billion. This money could have been used to build and improve on health to uplift the poor and vulnerable. Instead, it had to be used for damages the department caused. More of half of these were as a result of cerebral palsy and deliveries resulting in poor children being challenged for the rest of their lives. The AG has warned about non-compliance of procurement procedures and performance. So has the Portfolio Committee, year on year on year. And yes, we've listened to your speeches today. You came here today with a barrel of cowpat covered in syrup. No amount of sugar coating changes the fact. Cowpat is cowpat, and you are knee deep in it. You are far away from dealing with the real health crisis. That is, it has collapsed. And I close, Chairperson, with another quote. People only get mad and defensive about certain topics when they know they are guilty. I wonder how well you slept last night. Thank you, Chairperson.
Very much. Can I now go back to Honorable Hendricks of Al Jama? Honorable Hendricks, I was informed that you are available. In that case, I think let's then move to Honorable Munyai from the ANC. Honorable.
Thank you very much, Honorable Chair, Honorable Chairperson, Honorable members, and the people of South Africa, all protocol observed. Let me start by the Freedom Charter Class 101. 8th clause of the Freedom Charter on health, there shall be houses, security, and comfort. To be relevant, open quote, a preventative healthcare schemes shall be run by the state. Free medical care and hospitalization shall be provided for all, with special care for mothers and young children. The aged and the orphans and the disabled and the sick shall be cared for by the state, close quote. That was Freedom Charter Clause 101. The scheme that we refer to that will be run by the state is the National Health Insurance under progress in Parliament. So that's how we govern. So let me start with the fiscal framework. The fiscal structure enshrined in the Constitution, which in Section 40 established national, provincial, and local spheres of government, which are distinctive, interdependent, and interrelated, has led to some of the fragmentation and disconnection in a manner in which limited financial, human, and also infrastructure resources are utilized to the greater good of South African citizens. Due to historical distribution of the population, there's been some challenges in ensuring effective, equitable, and efficient allocation of the health sector resources to address the population health needs. Our national health care system is also constrained, Honorable Chair, by the number of patients purported who are a foreign national, who are also not accounted for in the planning and budgeting, which constrains our resources. In this context, we shall continue to serve this foreign national, consistent with UN Convention, especially with the emergency services and notifiable disease. We welcome the commitment by the Minister of Health and of course an encouragement on the annual performance plan and the budget that is working on investigating to what extent and the usages of the healthcare services by undocumented foreign nationals and what intervention need to be taken forward. It will be important that government accelerate this review and consider other services of revenue to augment the strained fiscal space in represent provinces. In this regard, Honorable Chair, and in this context, the ANC put forward unwavering support on Budget Vote 18, and we shall play our robust oversight role to ensure that the department improve governance, particularly at the call phase of services in our hospitals and clinics across the Republic. With respect to COVID-19, as you will know, Honorable Chairperson, COVID-19 has brought the unprecedented havoc that South African global humanity has ever seen. The collective response to the vaccination program, it's a critical preventative intervention that was way above and beyond the country's expectation and satisfactions. With strong sense of patriotism, we salute and pride ourselves to congratulate the ministry and the Department of Health on excellent work that they have done in the past 2 years in their battle against COVID-19. The World Health Organization Director General, after visiting South Africa, congratulated Minister Dr. Joe Phaahla and the country for the great work of South Africa was doing in combating COVID-19. Of course, the blind will not see this great progress. Honorable Chairperson, we must underscore that no economy can grow sustainably without having healthy workforce. It is within this context that we salute our healthcare workers who are the backbone and the lifeblood of our healthcare system, who fought side by side in combating COVID-19. Open quote, we can only guarantee the good health of our people because the healthcare workers are very critical to our healthcare system. After celebrating the International Workers' Day, we wish to encourage you, South African workers, and also the international workers, with old, of course, Marxist message from Karl Marx, open quote, workers of the world unite. You can lose nothing but your chains, close quote. A luta continua. Honorable Chairperson and the people, we need to ensure that all other programs that have been negatively affected by COVID-19 pandemic must receive the necessary attention they deserve as practical and urgent as possible. In this regard, we support the Department of Health to eliminate malaria by 2030. Honorable Chairperson, unashamedly, we have an obligation to transform the healthcare sector of South Africa, which is the fundamental necessity. We must put on record that since the pandemic, we're facing the numerous internal and external risks which affect the strategic and technical capacity of our developmental state to deliver on the quality of healthcare. With regard to national health insurance, Honorable Chairperson and the people of South Africa, the development and maintenance of for the past 27 years, or 20 years, 28 years, the ANC-led government has built many hospitals and clinics. Going forward, we're concerned about provision of the quality of care. In this regard, related to infrastructure development, but also the challenges remains the dual healthcare system. The people of South Africa agree that we must implement the National Health Insurance Fund, serving as a single purchaser and single payer of healthcare services to ensure that equitable and fair distribution and use the healthcare services to all our people. The people of South Africa agree that we must address the disparities through health financial reforms through the National Health Insurance Fund. The road towards the universal healthcare coverage will not be a simple one because it requires the eradication of structural challenges due to injustice of the past, which affect our healthcare system until to this day. Open quote, the beneficiary of the apartheid are not going to give up without fighting against the NHI. Those, of course, that represent the laissez-faire and the big business and big insurance, the NHI. They do not want NHI because of greed and corruption. We have seen during the 2019 World Cup that when the big business do corruption, they said it's collusion. Yet we know that this is corruption. Honorable Chairperson, the people of South Africa agree with the white paper, noting that, open quote, national health insurance, it's a health financing system that is designed to pool the funds to provide access to quality, affordable personal health services for all South Africans based on their health needs, irrespective of the socioeconomic status. NHI intends to ensure that they use the health services do not result in financial hardship for individuals and their families, close quote. It is imperative that we assert and quote President Ramaphosa in line with the NHI white paper. Open quote, NHI represents substantial policy shift that will necessitate a massive reorganization of the current healthcare system. Both public and private also derives in the mandate from the National Development Plan of our country, close quote. The people of South Africa agree that we should defend these democratic policy gains, despite the forces opposed to progressive change, seeking to divert us from the advancement of the national democratic revolution. The people of South Africa and the ANC agree that we must play our robust oversight role to ensure that the department improve on governance, particularly on the coal-face services of hospitals and clinics. Honorable members, and also the people of South Africa, we must agree that the government have a long-term vision and a plan. This budget vote contains in the National Health Insurance Program will really help us to focus on the areas of the NHI, and this budget targets about 5.5 million patients registered in the central chronic medication dispensation, as the deputy ministers would have said. We need to support that program. As part of the phase-in implementation of the NHI, we need to address the infrastructure gap and maintenance of the current health infrastructure. Over the medium-term expenditure framework, 8.8 billion has been allocated through the National Health Infrastructure Indirect Grant. With regard to the expansion of the health services in rural areas, new clinics and hospitals need to be built. The people of South Africa and they agree that we will ensure that the department should finalize and monitor implementation of the Human Resource Health Strategy and a plan of 2019-2024 to ensure that vacancies are timeously filled, including all clinical and non-clinical and senior level positions. By 2022 is the last year of the implementation of the National Strategic Plan for HIV and TB and STI 2017 to 2022 has been deferred to 2023. This issue, the minister has clarified, we have not realized this target of the National Strategic Plan in areas such as the 90-90-90 target. to ensure that 90% of our people infected with HIV should know their status. 90% of those who have tested positive should be able to be sustained on treatment, and 90% on treatment should be really virally suppressed. This issue, Mr. Honorable Minister has covered in his own presentation. There are important targets towards eradicating HIV, TB, and STIs. We must say by 2021, we've seen progress. The SOEs of the Department of Health has made progress. Majority of them have received clean audit during the year under review. It is critical to highlight the progress of key health outcome measurement. And honorable members, with regards to maternal mortality, as raised by the Deputy Minister and Facility Ratio nationally.
Your time has expired, Honorable Member.
Honorable Chair, we support this budget vote unwaveringly. Thank you.
Thank you very much. Can we now ask the Minister to take the floor? Honorable Minister.
Thank you very much, Honorable Chairperson. Firstly, let me thank all the honorable members who have made their contribution to this budget vote. Thank all those who have supported our budget vote. I'll just comment on a few matters which have been raised, Honorable Hlengwa, on the issue of medicines stock out. That's a matter which we're monitoring through our stock visibility system. We will make sure that if you could also give us some warning in the areas which you might be aware. We do have this system, but the system also depends on those at the coal face, making sure that they do report on their stock levels and reporting on the system, and then it can fit in where we're able to monitor. Also, in as far as the audits, problems of qualified audits, I think at least at this stage, none of our departments in provinces have disclaimers, so many are still struggling with qualified audits. Our financial division from the Chief Financial Officer's office does work with, they've got a forum of CFOs through which they compare notes and look at the areas which are perpetually problematic, including the kind of unauthorized expenditure, for instance, as a major cause of qualification by the Auditor General. I think Honorable Dr. Tembekwayo, aside from the insults, I think where there's some issues of substance, the Deputy Minister has adequately answered, and he will be providing further information in some of the matters which you have raised. Honorable Van Staden and others have raised concern, and Honorable Van Staden claims that the budget is going to be stolen. I'm sure even he is aware that he is really exaggerating a problem which is there in terms of some time where public resources are not properly utilized, but we do have the systems through which we monitor. And I can also just add to say that I think Honorable Ismail also make reference to the issues of poor governance and corruption. But what they don't admit is the fact that many of these areas have actually been exposed and put through to the SIU by our own government through the proclamations by the President who signed these proclamations that these matters should be investigated. That's why the public is aware, and all these reports, once they are released, they are made public. That is not acknowledged. I'm sure it's not very comfortable for members from the opposition to acknowledge that indeed this ANC government is hard and very committed to making sure that where there are irregularities, poor governance, and corruption, it's pursued, and whatever findings, they're actually not swept under the carpet, but they're made public. Honorable Sheikh Imam, the issues of community health workers, we are indeed quite far. As you might be aware, there is interim agreements with labor unions in terms of where there is uncertainty in terms of the benefits of community health workers. There are still matters which, through the Public Service Bargaining Council, some of the matters are still being thrashed out to make sure that there can be even more certainty in terms of the role. But we are very unwavering in our commitment to make sure that community health workers are well integrated into the public health system, because as I've said, they are very key in various areas of health promotion, prevention of disease, making sure that those who have lost to follow-up of treatment of chronic diseases, including HIV and TB, can be traced and put back on treatment. The issue of litigation, again, Honorable Wilson, just to sift out, the kind of personal attacks, but on the substantial issues, the issue of medical litigation is a major issue. Indeed, some of our provinces are really struggling as a result of major problems of leakage from litigation. And as I've mentioned, we're making sure that we close the tab on all this. Chair, as I conclude, let me just say again that while it's been difficult 2 years, we are very confident that there's a light at the end of the tunnel, that we believe that the pandemic is moving very closely to its end, where we should be able, with all the experience, all the interventions, we should be able to control the impact of the pandemic. And as we do that, make sure that we can build a sustainable and resilient health service. Thank you very much, Honorable Chair.
Thank you very much, Honorable Minister. Before we conclude the business, there was a point of order, and I think the point of order should have been in terms of Rule 85 on the insinuations that were alleged. Yes, there is an indication that there were such statements, but what is not clear is to who were they directed to. But I'm sure from the comments of the minister, we can note that in terms of Rule 85, members are prohibited from indicating any such issues related to members. So we can stop at it by saying we are urging members to avoid indicating things that they may not be able to substantiate. So that's the ruling for now. We are unable to say exactly as to whether this was directed to the minister or to who. That concludes then the business of the debate and the business of this visual mini plenary session. The mini plenary session will now rise. Thank you very much, honorable members. The mini plenary is rising. Thank you.
Thank you,
Thank
Chair.
you.